Hey everyone, I'm Dr. Nick with Atlanta Physical Therapy here with a really special guest, Dr. William Mills. He is a fellow male pelvic floor physical therapist, and you do, from our conversations, specialize in men's pelvic health, as
Yes.
I do. And your company, as I see, I mean, is perfectly aligned on the screen. Alinea, am I pronouncing that right? I don't know if I ever
Yeah.
asked. It
Yeah,
is.
you got it.
Awesome. Well, why don't you go ahead and give us a little bit of an introduction of yourself, Doc Mills?
Yeah, so I have I've been doing men's pelvic health since shortly after I got out of physical therapy school. So I'm coming up on my 5th year as a practicing clinician. Um, men's pelvic health was not on my radar at all. Like I knew about it. I knew about pelvic health prior, um, especially with women, because women's pelvic health was blowing up during being in school for me, as well as when I first got out. And I was approached by another therapist who encouraged me um, to basically give it a shot because of how few men are in the space. And the story that got me, and I tell this all the time, the story that got me was she told me about a patient of hers that had testicular pain, had gone through seeing, 10 plus urologists, had doors slammed in his face multiple times, had no answers, um, was currently seeing a urologist who they basically said the only thing that we could do is remove the testicle because there's nothing else to do for it. So they did that. They removed one of his boys. It got better for a little while, and then it came back in the lone survivor,
Oh,
and he didn't know what to do. He and then that's when he found her as a pelvic floor PT. Um, he was looking into like this guy's mid 30s, wants to have a family one day. He was looking into what it would look like to store sperm because they were going to want to remove the other one, and then he was going to have no testicles. Um, Not something that was cancerous, just nerve pain. And he started seeing her, and after 3 sessions, it was 75% better, and his whole life changed. Right. So that's a very, you know, explicit, dramatic story. And I've seen multiple iterations of that with different cases surrounding the pelvic floor and things that can go wrong with it in men. Um, but that's the story that got me is like, I feel like if I was working with those kind of patients, they would be very motivated to get better. Um, and it would fit well with what I had planned on doing in the CrossFit space at the time, because I wanted to work with CrossFitters because you don't have to convince them to do the work and get better. They just want to get better so they can continue doing their daily activities. So when you're thinking about, especially sexual function in men, it's like, yeah, most men want to be able to operate down there. So it's usually it's not like pulling teeth. And that's what got me into it. So since then, I've taken a handful of the Herman and Wallace courses, is how I was formally trained,
mhm.
um, and taken a lot of stuff online. Joe Milios is one of my big researcher. I'm an absolute fangirl of hers on things that she's researching in Australia on how to rehab prostate cancer patients, which is currently what I do the most of in the pelvic health side of my practice.
Yeah, can
Uh,
you tell us a little bit more about that? Because I think that's something that you started to, like you said, specialize in a little bit more specifically. Was prostate cancer? Did I get that right? And also, I want to comment that I think I speak for everyone. I say that I had sympathy pain during your story. So anyone who has testicles that's watching this right now has like a slight, at least a slight ache in the pelvic region, but
Yes.
it should go away shortly after the story. So if
Yeah.
you're watching and you're feeling that, don't worry. You probably don't need to see pelvic floor physical therapist just yet.
Just keep breathing.
Just keep breathing. Yeah.
Let your
Full
pelvic floor
diaphragmatic
blow on
breathing.
you whenever you inhale. It'll be
Yep.
fine. Yeah. A buddy of mine just had a vasectomy, and he was texting me the other day. He's like, dude, my nuts hurting. I don't know what to do. I'm like, like, did it just come out of the blue? Like, are you sitting? Did you lift something? He's like, no, it's just hurting. I'm like, take a deep breath. That feels. See what happens if you relax your pelvic floor. And he's like, okay, I did. I think it's better. I'm like, great.
I know pelvic health is like
Will do.
so like it can be so simple, can it?
It can be simple. It can also be very complicated.
Mm-hmm.
The interesting thing, and I guess more specifically with the prostate cancer guys, is, um, historically speaking, urologists hand the guys that are about to have the surgery a sheet, a pre-op sheet, or these are the things that you need to do once you go home. And it's like, do 3 sets of 10 Kegels every day until the end of time, right? And it's not like there's a how, what, why, and when associated with doing Kegels, not just do them.
Mm-hmm.
And I've had 3 guys between me and my business partner, Joey Rosie, has a Linea Performance in Tampa, and then Andrew Gillihan is our third guy that we just brought on. He's not currently seeing men's pelvic health, but he's in Cincinnati. But me and Joey are actively treating men right now. And between the two of us, we've had 3 guys come in following their prostatectomy, were given a sheet, told to do Kegels, did them to the utmost degree incorrectly, and basically gave themselves a hernia from just bearing down and not doing them well, right?
And for those who don't know, what is a prostatectomy?
So a prostatectomy or prostatectomy, I feel like you could say both.
I always like interchange between
there's
like extra
two
tech
T's in there. Yeah, there's 2 T's in there. It's
just to appease the masses.
Yeah, yeah. So that's gonna happen if a male has been diagnosed with prostate cancer, and the urologist, the oncologist that's on the case have decided to remove the prostate, to avoid that cancer spreading. So whenever that happens, you have what's called a sphincter inside of your prostate, that goes around your urethra, which is basically your pee chute. And when that gets removed, it's kind of a free-flowing free-for-all once you get your catheter out, and you're going to have issues with incontinence and peeing on yourself, as well as erectile dysfunction. So I help solve that problem, more quickly than just the wait and see approach, or the go home, take it easy, don't lift over 10 pounds, do these Kegels a week or 2 after you get your catheter removed. It's a little bit more dense, right?
Mm-hmm.
We talk a lot about like a lifestyle assessment. I prefer to treat guys, 5 to 7 weeks prior to their surgery, so we could get them doing the appropriate, just habitual things better, like getting on a pee schedule. How much water are you drinking? What are your toileting habits? Self-assessing those things, and then educating the guys on the fact that, like, all in all, how you do these things, how you do everything else but Kegels, is probably going to be more important than you actually doing 3 sets of 10 Kegels, or 10 sets of 10 Kegels, because 3 sets of 10 isn't that much anyway, especially for strengthening purposes.
There's that CrossFit mind of yours.
Yes. and Joe. Milios. That's her stuff suggests the 10 sets of 10 or 12 sets of 10 or 12 sets of 15. Working up is better for those like quick flick sets once you're getting past getting guys just doing holds. And what I phrase is keeping the gate closed. Um, Once you've gotten past that and you've established control, then it's like training any other kind of muscle where, a bicep doesn't just, hold a plate like this. Like it does different things. There's different positions. It goes around, it lengthens, it tenses. The pelvic floor is very similar. But a lot of the guys that I've seen from a standpoint of they're in that continued incontinence. They either went to another pelvic therapist, they didn't get better, or they didn't go to any therapy and they're going back to their urologist just as a 3-year follow-up and they're still incontinent. Then they get sent over. And then we talk about like what are the things that they did. And I'm like, it might seem like you did a lot, but you really didn't do all that much. If this is like a 3,000 step process, you might have done like 50 steps. So for you, that's good news in the sense of we have a lot to try to get this thing better versus this is just something that you have to live with. So a lot of what I do is, in a way, I feel like it's counseling guys like on the process.
Well, education is so important. I mean,
Yeah,
a lot of people come in and into my office too, and they're expecting a whole digital rectal exam, like the glove, like the whole nine, day one, like there's nothing else we can do. But our words are so powerful, and just
yeah.
education. And I mean, it sounds like you do a really great job of that. So I have no doubt that your patients are definitely seeing some good results.
Yeah. We're huge on education. And on the first visit with prostate cancer guys, I'm not doing a digital rectal exam. I'll usually do that on the second visit, um, if it's warranted, because it gives us a lot of information as far as their strength and how those different contractions happen. Um, but I've recently, like, I don't even I address immediately. Go ahead and have a seat. Today we're going to be talking a lot. Like you might have thought that you were just going to come in and immediately start doing Kegels, and like we're not going to do any exercises today. I'm like, no, we're going to talk about how much water you drink.
It's so
Chronically,
important, though. You need
chronically
to.
dehydrated and chronically constipated. And if you're chronically constipated, you're probably going to pee on yourself more. Like we need to solve that issue. It's way more important than just doing arbitrary Kegels. Not that Kegels aren't important. Everybody that's incontinent that's come through my door for prostatectomy rehab, they have weakened pelvic floor muscles because the surgery affected those muscles. We're gonna do Kegels. It's just not all about Kegels.
And I mean, men are innately, we are not in tune with our pelvic floor like women are.
Absolutely not.
I mean, we only go to the urologist, the male equivalent of the gynecologist, once we have like a catastrophic freaking problem in our 30s to 40s, like for the first time. So I mean, how often does someone come in and they are just squeezing their butt cheeks when you're asking them to engage like their levator ani or the Kegel muscle?
Yeah, that's
Is that
9.
a whole other interview? Is that
Yeah, that's like 9.8 times out of 10 guys aren't doing it right. Or it's just like if it isn't a breath hold, an abdominal squeeze, and a full body contraction, like they just got electrocuted. It's and they're actually doing the Kegel. It's just gonna be a butthole lift rather than like a penile retraction, which is more helpful for stopping your flow of urine. It's very common, and Joe Milios talks a lot about this in her research. which is where I base a lot of, I base most of my treatment protocols off of that research, is that it's a crazy statistic. It might be 70+% of men, um, when they were testing how guys do a Kegel, none of them actually lift from the front. It's all from the back. And, it's not a well-rounded contraction to stop your flow of urine if that is your problem. So definitely some undoing as far as the how, for sure.
Wow. Well, Dr. Mills, I know that you have a time crunch here, so I
Yeah,
do want to talk more. I was
sure.
keeping track for you.
Yeah,
But that being said, we need to revisit this
yeah,
because this was really helpful for me and anyone listening. I know for a fact, and there is just so much more that I want to get into with you. So
sure.
to finish up though, can you just tell our viewers, Doc Mills, how can people get a hold of you if they wanted to? Anyone listening over in your neck of the woods or maybe in my neck of the woods, and they're like, man, I just want to give them a call.
Yeah. So you could find me on my socials. My socials are Doc Mills DPT or .dpt on Facebook and Instagram. I'm on TikTok. I don't post as much on TikTok. I need to get on there more often. And then at
Trendy.
Alinea Performance is the clinic space. Our website is www.alineaperformance.com. You can reach me there. My email's on there as well. My emails and my socials, as well as the phone number. Right, 2022. You can text our office line because it is a cell
Nice.
phone, not a landline.
Nice.
So
I do the
feel free
same
to
thing
text
actually.
me,
I
of
mean,
course.
everyone loves texting now.
Dude, I have to tell people, like, yes, you can in fact text the line. Like, it's not a landline. It's not your mom's primary care office. Like, you can text us, it works. So yeah,
Awesome. Well, hey, Doc Mills, I really appreciate your time. I hope we can get on and do this
absolutely.
again, dive into maybe a little more detail or another topic in men's health altogether.
Absolutely.
But yes, from me and all of our audience, thank you very much.
Thanks for having me. I appreciate you raising awareness during Movember.
Yes, that's right. I mean, I'm sorry, I got to take a minute to do the plug for Movember here. I almost forgot. If you want so I'm growing my beard out. I usually don't have a beard, and as you can see, I don't grow very well. But head over to movember.com/donate if you're watching this, and you can leave any amount of money. Don't even tell me how much you left. DM me, and you'll be entered into the raffle for designing my beard on November 30th. All right.
It's gonna be
Thank you,
awesome.
everyone. Thank you, Doc Mills. We'll talk soon. All right.
All right, man. Thank you.
Mhm.